Takes a minute. Okay, you're live.
Thank you so much. Good morning, everyone. Welcome to the Health and Government Operations Public Health Minority Disparities Committee. Thank you for coming. I know it's early. We really appreciate it. Today on our agenda, we have two bills, and we're going to start first with House Bill 1280. I want to thank the members for coming and the stakeholders as well. Aaron, you can go ahead and describe the bill and then also describe the amendment. We did discuss this at the last meeting. Thank you so much, Aaron.
This bill establishes the Maryland Behavioral Health and Public Safety Center of Excellence in the Governor's Office of Crime Prevention, Youth and Victim Services. At the last subcommittee meeting, we walked through the bill and discussed it pretty substantially, and there have been two amendments that have been suggested by Delegate Hill, and I sent another reprint of the bill to you all. If you look on page 3 of the reprint, after line 13, Delegate Hill had concerns that just wanted to make sure that the models, plans, policies, strategies, programs, and technical assistance and training that was offered by the center, that the center would continuously monitor and analyze the validity of these programs. So you can see that in the new subsection C, there's language that they would look at the validity of their plans, policies, and strategies. And then if you move on to page 5 of the reprint, lines 1 and 2, this provides that the behavioral health services screening processes that are used at jail booking would be, that the center would have a plan for their application being appropriate, and also that they are properly applied. So that clarifying language is added in Delegate Hill's amendments.
Thank you. And then when we were last here, we discussed that there were many stakeholders that were involved. The Lieutenant Governor, this is actually a recommendation from the Lieutenant Governor's Commission on Behavioral Health. We had NAMI, the Public Defender's Office, CASTA, NAACP. We also had former incarcerated individuals that participated in it, and this will be help in developing a statewide model. When we ask ourselves, why is this bill being introduced? It's basically to prevent individuals with behavioral health disorders from entering the criminal justice system. We know that there are many people in the criminal justice system that do not belong in the prison, that they have an honest, behavioral health illness. This model will divert individuals from further penetration of the criminal justice system, and then will engage individual in treatment as they exit the criminal justice system. So that is the intent of the bill. It brings all the stakeholders together. The governor's office is willing to house it. They're willing to, staff it. They're willing to work with the locals as well. I will now go to Jake Whitaker from the Lieutenant Governor's office and the governor's office. And then after that, we'll go to Senator Hester's Chief of Staff. Good morning, Jake.
Good morning, Madam Chair. I just want to reiterate that's exactly what this bill is intended to do, to make sure that folks who need mental health services get those services rather than being incarcerated. And I just want to thank Delegate Hill for her suggestions on making sure that there are safeguards so that the bill accomplishes that goal. So with that, I just respectfully request that the committee move forward with this bill, please.
Thank you for coming again. We really appreciate you. We just want to make sure that our members and myself know clearly, what the intent is, and as we move forward.
Absolutely.
Go ahead. Thank you. So we have Nitin.
Thank you, Madam Chair. I couldn't say it better myself, so I won't say it again. Just thank you for your consideration. Thank you to the chair and the governor's office for their partnership. Thank you to Delegate Hill for her thoughtful improvements to the bill, and thank you all for your consideration of this legislation. We kindly request a favorable report for this bill.
Are there any questions or discussions from any of our members. I am not able to see your little hand because my computer is not working here in the hotel room, so I'm using my phone. If just unmute yourself, please, and ask the question.
Okay, thank you, Madam Chair. This is Delegate Riley. I have a question. So I see that this is, I really believe in the intent of the bill. It's great. But I had a couple questions. So basically this is the, to create the department, and then they're going to look into all of these things. But I had a question. So once we figure out all of this, okay, so where are these folks going to go? Are we going to create centers for these folks to go since they're not going to go to jail? Or what's the intent here? And is it on any particular crime, or is that what this study is going to do to figure out, how we're going to do that? If they have a mental illness right now, unfortunately, they're all going into the jail. And I do believe that that's not where they belong. So where are they going to go?
So on page of the interlineated copy, if you go to page 4 of 6,
4?
yes, go to line 7, it says the center shall develop the following: a statewide model for law enforcement assisted diversion,
Right.
recommendations for pretrial services, procedures for sharing deflection and diversion statistics between relevant state agencies, recommendations for statewide implementation of law enforcement assisted diversion programs. And diversion programs are programs that basically would offer someone, you do community hours, or you go to anger management, or you go to counseling, and in 9 months, we would drop the case. So, and then it says also recommendations for statewide implementation of law enforcement assisted diversion programs and a statewide model for community crisis intervention services other than law enforcement. So these are recommendations that they will have as a statewide model for law enforcement, for community crisis intervention, for the local governments as well. The center is not going to be doing the treatment, or people are not going to go there. They're going to make recommendations of best policies that work, that are impactful for the local government, law enforcement, localities to implement in their local jurisdictions.
Right. So the local jurisdictions will eventually have to have some place for these folks to go and to be treated, correct?
The local jurisdictions will implement these recommendations, and part
Right.
of these recommendations mean that the local jurisdictions will have to have some crisis response services, develop harm reduction strategies, and they will have to have some programs. Yes, some of them already exist, but we're not connecting the individuals as
Right.
well.
Yeah,
Madam
we have some great places in Hartford that, deal with, alcohol and things like that, alcohol and drugs. But I'm just having a real problem with, first of all, we don't have these facilities currently. I understand what the bill's doing to get us there. But that's going to
Delegate Rowley, Madam Chair, if I may.
Yes.
go ahead. Yes, thank you.
So Delegate Rowley, I understand what you're saying is if we're not putting them in jail, are they just going to be stuck somewhere? And
Right.
that is actually a question that we began to address before you came on the committee. When we put through the Justice Reinvestment Act, which you were part of, but not as part of the committee. The primary reason that HGO was involved was because of that transition period. So as the chairman's just said, we have been putting these programs and facilities in place. We took money from the Cigarette Restitution Fund escrow account, put into exactly these kinds of things. So they have been established. There aren't enough, but they have the ability to expand, and have to finesse our referral systems a little bit better. And a lot of the other bills that we've been passing out the last 2 sessions have been directed at how we support them so that they can do the mission. So we're not starting from scratch. We're just trying to be more deliberate in how we take what's happening well in certain parts of the state to expand those models into other parts of the state. So And we're also doing more things, which gets to the other bill we're talking about, to try and prevent so many people with behavioral health issues from getting caught up in the first place. So it's the right question. I just think that there's some work that's already been done that has not been discussed as much.
And in addition, the Justice Reinvestment is being housed under the Governor's Office of Crime Prevention as well. So this is why this will be housed there as well. There are already, as the delegate stated, there are already programs, and we have made investment in programs. Do we need more? Yes, and we hear that all the time in our committee. But this is a way to be consistent and to have a statewide model that hopefully everyone will follow, because you shouldn't get arrested in one county and you have one approach, and then in another county you have a different approach, because mental health is mental health. So this is a way to have consistency.
Okay, thank you.
My pleasure. Are there any other questions or concerns? Please unmute yourself.
Nitin has his hand up.
Yes, Nitin, go ahead.
Yes, I was just going to address Delegate Riley's point once more, although I think Delegate did a great job covering it. The sequential intercept model could be used in this situation to identify what opportunities are in your area for diversion. And then in the course of doing their behavioral health planning, the local jurisdictions would come to find where they have gaps in services that they are unable to fill currently. So the planning effort would help them identify where folks should go and be diverted to, and then make more strategic investments in that area, just so I can speak to how the sequential intercept model fits into that framework.
Thank you. Any other, anyone else would like to speak on this?
Hello, if I may. Good morning.
And you did the
Can you hear
Justice
me?
Reinvestment. Yes, we can hear you. And I know you led the effort on Justice Reinvestment Act. So go ahead, speak away.
I'm just really compelled to just say that at the end of the day, there's going to be some great recommendations, but it's going to cost money. It is going to cost money. There's going to have to be an investment made here. Now, hopefully, based on these recommendations, these will be, you know, cost effective and the kind of investments that will have, you know, a great return, because people will be getting help and they won't be rotating in and out of the justice system. But it's going to cost money. There are going to be recommendations, and they're going to have to, the state is going to have to ante up, and local municipalities and the counties and Baltimore City are going to have to, you know, have the will to make the investments in these soon to come great recommendations. And I just, if you hear a little bit of frustration here, it's because, you know, all of us, you know, like to get around and get cozy on the idea of, you know, recommendations and stuff, but then people balk when it comes to the investment. And I'm glad that the administration is, you know, helping to lead the way on this. But, you know, I hope that the folks on this call and the offices that we represent will support the recommendations when they come, including the inevitable funding and investment that has to come with it. So I'm sorry to, you know, go in a mini rant here, but it's, you know, we have a lot of reports and recommendations that come, and then there's often a lot of hesitancy and resistance when it comes to the funding. So I hope that we not only supporting this bill and supporting what's behind it means really making the effort when the time comes to put our money where the mouth is. Thank you.
And if I may add, on line 6, everyone, page 3, line 9 of the interlineated copy, page 3, it says identify and inform any relevant stakeholder of any federal funding available to the center to carry out the mission of the center, including through the provision of grants, scholarships, and other funding to recipients engaged in training, the provision of services or the study of matters relating to behavioral health, public safety, and criminal justice. Then on line 14, same page, the center may enter into contracts with the University of Maryland system, Maryland HBCUs, and other entities or organizations for the purpose of carrying out its mission. Then you go to page 4, line 25, it says the center shall provide technical assistance to local government for the purpose of sharing best practices across the jurisdiction, applying for grants to support work related to behavioral health, public safety, and criminal justice. But it also says this operation of the center is subject to the limitations of the state budget. So it's very balanced as well. And we understand that it would take some investment, but the governor's office is committed to carrying out this bill, because it really, at the end of the day, we will save money when we can divert people from the criminal justice system. We make them whole. They can be productive, active citizens, and they can get the help they need. So if you see that the bill is very balanced, because we work with many stakeholders in taking this into consideration. Any other questions or concerns from the body?
Delegate Schlager has her hand up. Delegate Schlager.
Thank you. And I do support this bill. I have always planned on voting for it. I think it's a great idea, but Delegate Barron, I want you to know I am not supporting tax increases. So I don't know if that's what you meant by your comments. I'm happy to help you look for savings in other places.
I didn't say anything about tax increases.
All right, but you insinuated it, and people listening.
No, I did not insinuate.
Okay.
And if you interpret it that way, I'm sorry to interrupt, but let me correct.
Thank you. Please correct, because I want to support this bill, but I am not supporting tax increases.
Well, I don't, as far as I've heard, I haven't seen anything about taxes in the bill. I didn't say anything about taxes. Didn't insinuate anything about taxes, but there are going to be recommendations. There are going to be things to do and change, and policy changes and practices that will not be free.
All right, I appreciate that. I wanted to clarify that I'm happy to, I think this is a great idea. I think this bill came out of a hard work and much thought. And I think, we should pass the bill. And I'm glad to see that we're doing it with existing resources. Thank you.
My pleasure. So just to be clear, there's nothing in the bill regarding taxes, okay? So let's just move on from that.
May I move the amendments?
Yes.
Second.
Any concerns or questions on the amendment? All right, seeing none. All those in favor say aye.
Aye.
Any opposed? Is unanimous. On the bill as amended, may I have a motion, please?
Motion to move the bill as amended.
Second.
It's been moved and second. Are there any concerns regarding this bill? Any questions regarding this bill? Seeing none, all those in favor say aye.
Aye.
Any opposition? No opposition. It passes unanimous. Thank you so much. I want to thank the governor's office, the lieutenant governor. I know that he has put so much work into it, and I'm grateful for all the work and the hard labor, and Delegate Senator Hester's staff and Senator Hester. Thank you for your leadership on it. I was reading the report that came out. It says Maryland Lieutenant Governor's Commission on Mental Health. I don't know if our members saw it, you got it. It was delivered to your office. It's really good. It's the work that he has been doing, and this is one of the recommendations. And I would recommend on your spare time that you don't have, that you can read it. That's what I was doing last night. Anyway, thank you so much for your time on this. Next, we're moving to our last bill of the day. And last time we discussed it, there were some questions. I want to start by saying that we decided that we are moving with House Bill 1280 for now. I know that Delegate Lewis has a bill as well. I spoke to Delegate Lewis about that. You know, the House wants to wait for her bill to come to the House. There's no reason why they can move together if that was the choice that the House wanted to do. They're just not sure yet that that's what they want to do, because her bill is a statewide commission, and we just passed a huge statewide commission, the Shirley Nathan Pulliam Commission, and we don't want to, you know, burden the department, because that statewide commission brings, Shirley Nathan Pulliam Commission brings all the departments together, and they have to meet at least 4 times a year. So Delegate Lewis's bill will be a statewide commission as well, and leadership is a little concerned about that. So we're going to put that on hold for now. She understands. I spoke with her, and I thank you, Delegate Lewis. I know you're on the call. Thank you for being flexible. So Erin, can you please describe 1280? And Delegate Chisholm, I thank you for bringing it up, and it made us go back and talk about it. So thank you for your question. Erin, will you be so kind and describe the bill again?
Excuse me, Jocelyn, Chairman, I do have to drop off because I do have another commitment with our delegation that I have to do before we go online at 9. So,
okay.
Okay.
Thank you very much
Right.
for coming. I appreciate it. Oh, you're welcome.
This bill establishes the work group on screening related to adverse childhood experiences. And this would be a 2-year work group in the Department of Health that is comprised of members from the Maryland Department of Health, MSDE, and then various stakeholders and parents of students in the school system. They would look at very specific issues related to adverse childhood experiences. We walked through this bill at the last subcommittee meeting. Delegate Shalega had some questions about who would collect the data that is gathered in this bill. The Youth Risk Behavior Survey is done through the CDC, and the data would be de-identified data. It would just be adding additional data points to the survey related to adverse childhood experiences. Delegate Queen is.
We can't hear you, Erin. You're muted.
And I just did a really good job. It just shows that nobody noticed it.
It was just the last part we didn't hear. And
Yeah,
it's
you were
783, Madam Chair, not 1280. We're talking 783, not 12.
Yes, 783.
And you had gotten through the survey, and then you said Delegate Queen, and then you went mute.
Okay, so I don't think you missed much, because Delegate Queen is on here, and she sent an email that I forwarded on to you all, if you got, that shows a template for the Youth Risk Behavior Survey. It also shows a program that was implemented in California and a website that they have done that could serve as a model should the work group recommend a similar program related to adverse childhood experiences.
So since we were last here, I did a lot of reading and research. So it's not only California, there's Pennsylvania, that has task forces, many other states. You know, I think it's important to define what adverse childhood experiences are. I know Delegate Riley had asked, and I went onto the CDC, and, you know, adverse childhood experiences are basically very well recognized from many studies. In the fiscal note on page 3, it says adverse childhood experiences are potentially traumatic events that occurred in a child's life, such as physical, emotional abuse, neglect, caregiver mental illness, substance abuse, and household violence. So basically, I went online to do a little research about it, and I learned a lot, although we already know the term from this committee. but ACEs can have lasting effect in multiple areas of our health. They increase the risk for developing certain conditions. There are 10 ACEs, 10 very well-recognized adverse childhood experiences. You have physical abuse is one. You have sexual abuse, verbal abuse, physical neglect, emotional neglect, a family member who is depressed or diagnosed with other mental illness, a family member who's addicted to alcohol or another substance, a family member who's in prison, witnessing a mother being abused and losing a parent to separation, divorce, or death. So basically, these are 10 questions that are asked. And what they have found out is that if you have experienced some of those, and the more you experience, okay, there's 10 of them. You know I went through it myself last night. I have experienced 7 of them out of the 10. The more you experience, the higher the risk is of you developing chronic illness, having substance use disorder, just having a tough life, not being able to hold a job. So the purpose of this bill is to identify early what those experiences have been, and then try to put community support for that young child to overcome that. And the research shows that ACEs can be prevented, and if addressed early, they can make a big impact, and also we save a lot of money as well. Delegate Queen, can you please address us?
Well, thank you. Thank you for allowing me to come in this morning. Well, Vice Chairman, you just said it all. I think you did a great study of what ACEs is about and what the impact of it and why it's important to have it. I think the question was around, that I heard, the question was around the data collection, and it's a known process to do it through the use of risk surveillance, behavior surveillance system. So that's already established. What would change is the type of questions you would ask, and the Vice Chair identified the 10 areas where those questions would come from. So those would be the questions that are added to that survey that's already done now on middle school and high school students in Maryland and other states as well. And then once you know that a person has X number of ACEs, as the Vice Chair mentioned, she went through and she had 7 of those. We find that there's data that talks about all adults have at least 4 or more, or at least up to 4. So the point is, once we know that, how do we provide and deploy resources and services to those families, to those communities, so that we can prevent some of the behavioral problems we see in school, some of them developing mental issues, or some of the issues of incarceration, that they follow these sort of patterns, as well as health issues that come out of the trauma of having ACEs at a young age. So that's the point of the bill. Hopefully we can do something here in Maryland. As was mentioned, we showed you, or we sent you the link that California is doing one of the jobs at it, but other states as well. But they really have a good program where they're working with their Department of Health, with the colleges nearby, and really have done a program that really has had fruitful results. So any questions for me? But that's basically it.
Okay, I now will open it to the committee. If you have a question, I can see your little hand, but Edith can help me with it, or maybe you can just unmute yourself, okay?
Yeah, Delegate Chisholm first and then Delegate Lewis.
I'm going to yield to Delegate Lewis first, because I know that she's probably got more in-depth questions that might answer mine.
Okay.
Thank you, Delegate
Chisholm. Madam Chair, thank you. And Delegate Queen, thank you so much for bringing this bill and really helping the state to put the concept of ACEs on the front burner. It's really important. I just wanted to say a couple of things. first, I think we should all remember that in the health code, the term adverse child experiences is in the code. And don't ask me where, I don't have my notes on that, but some smart committee counsel could probably do a quick search. But the
I can
point,
send it to you.
yeah, the point being is that, you know, the state is recognized as important, but we've just never acted on it. So this bill is really, really needed. And I look forward to seeing what the work group comes out with. The other thing I wanted to just ask really is whether the bill specifies membership on the work group, what entities, individuals, agencies, etc. are proposed to participate, because I have a suggestion about one we might consider if it's not already there.
Yes, so the bill, yeah, that's part of the bill to define the composition of the work group, to identify what would be some of the appropriate screening tools, as well as connecting communities, recommendations on connecting communities and families with resources. So the composition of the work group is defined. We have added some since we first, as amendments to the bill. I think when we brought the bill to you, we had an amendment to add others to that work group. So yes, that is.
Let me just, Delegate, go through the composition of the work group. The work group consists of the following members: the state superintendent of school or the state superintendent designee, the secretary of health or the secretary designee, the director of Maryland Department of Health Office of Population Health Improvement, or the director designee, the executive director of the Maryland State Council on Child Abuse, or the designee. The following members are appointed by the Secretary of Health: one mental health expert, one managed care plan expert, one behavioral health expert, one child welfare expert, one primary care provider who performs physical examination on children entering school for the first time. And you know that that's the law. They have to do that. The coordinator and epidemiologist charged with administering Maryland's Hugh Risk Behavior Survey. One representative from the Behavioral Health Administration with expertise in adverse childhood experience and positive childhood experiences. Two members of research community with expertise in adverse childhood experiences and positive childhood experiences. One coordinator of a local adverse childhood experiences initiative in the state. One director of local management board in the state with expertise in adverse childhood experiences and positive childhood experiences. One director of county parks and recreation department. One director of children's services for county library. One individual with expertise in public health, communication, and marketing issues. One representative of the State Domestic Violence Coalition. And then one parent or child in public, primary, or secondary school. It says, in consultation with the Public School Superintendent Association of Maryland or the Maryland Association of Elementary School Principal, one local superintendent or principal, and then one parent of public middle school or high school, and active in the student local public school, it says, one local system coordinator of mental health services, one representative of the Maryland School Psychologists Association, one representative of Maryland Psychological Association. The work group shall elect the chair of the work group by a majority of the vote at the first meeting.
Thank you, Madam Chair. I have a question.
Yes.
Also school nurses, you missed
Yeah,
it.
that was the only thing you missed was the school nurse.
It's in there.
You just
But
didn't, you just skipped over it. That's all.
I just didn't read it, I'm sorry. Go ahead.
Thank you, Madam Chair. And again, thank you, Delegate Queen. I would like to bring the committee's attention back to the innovative, groundbreaking work that's being done right now in Baltimore City around trauma-informed care. Trauma-informed care addresses ACEs. And what's interesting about the work in Baltimore is that a local commission's been created on trauma-informed care and is currently operating. It recently started up. I wonder if it might be useful, meaningful valuable to, if you be so indulgent to consider having a representative from the Baltimore City Trauma Informed Care Commission also, participating. The reason I think that could be a useful addition, the city commission's already addressing ACEs. They're testing and piloting interventions. They are training city employees, including the mayor was recently trained in how to recognize and reduce harm from ACEs. And so there's not already happening, and it might help inform or add value to the work of the ACEs work.
Okay.
That directed to me or to the committee as a?
No, let me handle that. Thank you. So you would like an amendment added to the bill, is that correct? Adding a representative?
Yes, ma'am. I'd like the
Okay.
committee to consider that. Yes.
Okay, great, and we will, okay? Any other questions or concerns? Delegate Chisholm,
Thank you, Madam Chair. So
thank you.
when we're talking about ACEs, obviously we're talking, domestic violence, sexual abuse, some obviously criminal activity. How is that handled? I know that we're asking this question at the elementary school level and then on up. I guess, what's the liability of maybe a kid telling somebody in these interviews when we're doing these surveys of what's going on at home? Does the school then take on an additional responsibility that they have to handle that? Obviously, ACEs is a pretty serious, there's some serious behavioral aspects or criminal aspects that they might have to deal with. I'm just curious on how it's handled procedurally or protocol wise now.
Okay, before I speak, Delegate Queen and then Aaron.
And so you're going beyond what I would know as a college professor and a delegate. I'm certain there is ways that we handle that now with students who may come to a school counselor or teacher and convey information that may be criminal. I'm assuming it's done in that sort of way, but that's part of this whole process of the screening. We already do screenings of things now, and how that's handled through the CDC youth surveillance behavioral system. I would assume it would be done the similar way, but I'm sure we can get that answer to you. But I
have the answer here.
Okay, thanks.
The report, the youth report, is distributed in secondary school, Delegate Chisholm. So secondary school would mean middle school, right?
Right.
Every 2 years, and it's an anonymous survey. It's a sample of student, and it cannot be used to address individual students' concern regarding ACEs. Okay, so that answers that. The other thing is that if information is obtained through a medical, when they require under the law that every child that enters the school system must have a medical examination. If the doctor at that point discovers abuse, then you know that there's certain people in our Maryland law, they have to report. So if it applies to them, then they will have to report it. I would think that if outside the survey, outside the doctor, a child came to a counselor and said, I was hit by my mom, or the counselor saw a bruise, again, they are required to report. So whatever that statute says, they will have to go ahead and report it. The survey is anonymous, and it is in secondary school.
I agree, but so now we're asking more probing questions, and I'm not against any of this. I'm just, we're now, a kid's not always going to come tell you about domestic violence or something they're dealing with on their own. But when you start to ask children questions, sometimes they'll open up and be willing, because they're scared, obviously, if they're dealing with domestic violence or one of those things. I was just curious on how, because now they're in a situation. And number two, if something is happening to a child and it's not addressed, it's even more difficult to help them, you know, if they've got some serious issues at home, whether they're not, you know, if they're being abused or if they see abuse, or obviously it's going to be even tougher to really help that child unless that's dealt with as well. It's just,
Yeah, and I think that part of the survey is to see what's going on with your student body, right? So if you obtain information that this is happening to your student body, you can have programs, you know, in school to address that. You can develop as a principal certain, you know, workshops, and as teachers in the classroom as well. So, you know, it's basically to be informed of what's going on with your student body. But again, it would depend, you know, who this child reports it to. But as far as this bill is concerned, it will be adding those questions to that survey that is anonymous and is given in secondary school.
yeah, and I agree. I understand. We're trying to solve the root of the problem, and sometimes being able to solve the root of the problem, we have to get to the actual.
Well, that's the point of the work group, is to talk about recommendations and to also talk about how do we help that community? How do we help that student as well as their family, and provide resources to them? So if you look at the intent of the work group is to talk to, along with connecting servicing agencies for that family, to provide intervention. So when we find out in this elementary school or this zip code, we have a lot of kids who are dealing with, you know, child abuse or alcoholism, or they're coming from families that the parents were deployed and they came back with these issues. We now know to bring some resources to those communities for intervention. That's the purpose of the work group, is to come up with how do we start to solve these problems. So
it's a broader approach, I guess.
It is.
Okay. Thank you, Madam Chair.
Thank you for your questions. I appreciate it. Any other questions or concerns? Okay, so we have we have the amendment of the bill, right? And then we have the amendment for Delegate Lewis. So let's take the amendments on the bill. Erin, can you just briefly discuss them?
The amendments were clarified that as to the members, it added a representative of the State Domestic Violence Coalition. It clarified that one of the members appointed by the State Superintendent of Schools would be in consultation with the Public School Superintendents Association of Maryland or the Maryland Association of Elementary School Principals when the local superintendent or principal was appointed. And it also required consultation with the Maryland Association of School Health Nurses when the school health nurse was appointed. And those were the only amendments offered.
Okay. They've been moved. May I have a second, please?
Second.
It's been moved in second. Any discussion on those amendments? All those in favor say aye.
Aye.
Any opposition? Seeing none, on the amendment for Delegate Robin Lewis, since they're already doing it and it's another way to get resources, to get expertise, I don't see why not. It wouldn't hurt. So Delegate Lewis, will you please just phrase it and so that we can move it?
Yes, ma'am. Thank you so much. I would offer an amendment to include a representative from the Baltimore, and I believe it's officially called, I'm gonna have to email you this language. I believe it's now officially called the Healing Cities Commission, a representative from that commission to serve as a member of the work group.
Right. And she's moved it. May I have a second, please?
Second.
Any discussion? All those in favor say aye.
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 Any opposition? Seeing none, on the bill as amended. May I have a motion, please?
Motion to move the bills amended.
Thank you.
Second.
And it's been moved in second. Any discussion on the bill as amended? Yes, Delegate Shalega.
Thank you. I
My
appreciate
pleasure.
work that's gone into this bill, but I don't see enough emphasis on parents. There are 2 parents on the work group. And I see, the pediatrician, that's great. But I really,
What would you like to add, Delegate?
I don't know how you add it. I'm just concerned that we're taking this issue outside of installing parents in the solution for these problems. And, I don't have an amendment. I have concerns because the parents are critical and crucial to, to children. And I think we move further and further away from that and instilling, quote, experts. And I don't think that's healthy. So I'm not going to be supporting the bill. And
We have 2 parents in
know
here.
why.
We
2
have,
parents. Yeah, I saw that. There's 2 parents too.
yeah, you have 1 parent of a child in public, primary or secondary school. You have 1 parent of public middle school or high school as well.
Yeah, I saw that. I mentioned it in my comments. I just don't think it's adequate. I don't think there's enough parental involvement and influence. And
But we're here now, so how can we fix it? Would you like to add 3 parents? What would be your solution?
I've thought about it. I read the bill. I listened. I looked at it, and I just don't. Don't see
Do you think if
the
we added
direction it's going in a way that I think is the right direction. So I just wanted to let you know voting against it.
So do you think maybe adding the Maryland PTA as a member will be okay?
Well, no, I don't.
Okay,
Yeah.
adding 5 parents?
Yeah, I just,
Honestly, I'm trying to find a solution because.
I appreciate, and I truly appreciate that, Delegate Penumelnik. I do. I appreciate your consideration of my concerns. It means a lot.
Yeah, because it matters, because if you have, then someone else will, and we're in subcommittee now, so I want to fix it to see what will be a good balance. Honestly, honest to God.
I appreciate that, and I just am not sure you can. I mean, this survey, I've read this survey, I've known about it for years. And you know what, I think that I don't like the survey. I think they're asking questions and incompetence that kids, I know for a fact, are not answering those surveys correctly. So, we're counting on that youth survey being accurate, and I guarantee you it's not. I don't, your kids are a little bit younger than mine, but, I heard them talking about this survey and laughing about how they answered it. And we're trying to be serious about this issue. I understand and I appreciate that. But, there's just multiple concerns I have with the bill, and maybe it's a philosophical difference of opinion, as we've said on this committee, on issues that we can't come to an agreement on. And I think that might be what.
No, I appreciate your comments. I think that we, discussed the bill that is thoughtful and balanced with the representation. If you wanted to add a couple more parents of the Maryland PTA, I will be open to it. But I know that it is a philosophical difference, and I respect that. So thank you so much.
Thank you.
My pleasure. Any other concerns from any other member? All right, on the bill as amended, all those in favor say aye.
Aye.
Any opposition? Can you please let me know? Delegate Shalega? Delegate Chisholm? Okay, so we have 2 opposed, and Delegate Riley is not here. She has another commitment, but she did come, okay?
Yeah, and I'm sorry, I have to go to that same delegation meeting, so I hate
We are done.
we
We're
got
done.
the
This
voting
is our-
before I have to leave. So
Thank you,
everybody.
Thank you. Thank you. We're done. This concludes our work for the morning. Do the members, do any of you have any questions? Any concerns? Beautiful. Thank you everyone for coming. I really appreciate it. Erin, thank you for your hard work. Delegate Queen, thank you for coming, and everyone else. Have a wonderful morning, okay? Thank you. And thank you, Edith, for staffing. Bye.
Bye-bye.